Hello, my lovely people. Good morning, good afternoon, good evening, good night. Welcome to my YouTube channel. My name is Jane. If this is the first time you are laying your eyes on this beautiful girl, I thank you so much for stopping by. My return subscribers, I love you. Like I always told you guys, for those of you that have started in this channel with me, I love you guys. Oh my God. What can I do? You know, we are getting to the 5,000 when I will do the giveaway. The giveaway is coming. I will give 20,000 to people in Nigeria. I beg to 5 people. I will bless 5 people in this channel, in this my channel. People that have supported me, people that have subscribed to my channel, people that have helped me in one way or the other. I will single-handedly pick and choose which one that I will bless with 20, because I cannot bless everybody now. I wish I can. Oh God, I wish I can. If I could, I would do it, but I can't, and you guys know that I can't. So I thank you guys. Please subscribe if you have not. Tell your brother, tell your sister. I say that's one big auntie in social media. She know they fear. She they talk waiting their mouth. She know they fear. If our next president will come to America and kidnap her and put her in a plane and take her back to Nigeria, she know they fear. And you are right. Thank you so much. So this video today, I am just going to tell you guys, I am a dialysis technician. I work in dialysis, okay? And I've been doing it now since 2011. Since 2011, I've been working in dialysis. So the little experience that I have working in dialysis, I'm not a doctor, that working in dialysis, that I will tell you, if you are a dialysis patient or you know somebody that is in dialysis, these are some little tips that you will do when you do it. You will just get your dialysis and live a longer life, long and healthy life. Because a lot of people are being not here anymore because of this small little mistakes. Because when you are in dialysis, just know that your kidney is not working, period. It's not working. There's no sugarcoating it. It's not working. And there's some things, thank God that we are here in America. And just because your kidney is not working, it's not a death sentence. It used to be. For Africans, it is a death sentence because they don't have hospital, they don't have anything. Yeah, so it is a death sentence. It is for rich people, it's for big people. So, but for us here in America, if you are here in America and you don't have papers, for the fact that you are on dialysis, they will not take you home. They will not take you home. That is, I've seen a lot of people that are in that situation and they ended up using that because you just can't send somebody who is sick, who is practically dying. You send them back home to where they come from, knowing that when they get there, it's a death sentence. Americans are not that wicked. They're not that wicked. They will not do that. So these are some tips that when you do it, everything is going to be okay. If you're a dialysis patient or you know somebody who is in dialysis, number one, if you wake up in the morning and you feel like you're not feeling good, go to the hospital. Because in dialysis centers, all they do there is treat you with the dialysis that you came there for. They don't have equipment to do anything. The highest thing they can do is to give you CPR, call 911 and wait for them to come and pick you up. A lot of people have been gone because they were sick. Either maybe they were overloaded or they haven't come their dialysis in a long time. They get sick or they are very, very sick. Or they have other underlying health problem that they know. And that thing is bothering them and they just ignore it and come to dialysis. When you come to dialysis like that, a lot of people, since I'm in dialysis, that's one thing I don't like about dialysis. I do not like it. I know people die every day, but the dialysis one, oh God. And some of them, people are causing it. The people that are on dialysis are causing it. Because if you think that you are sick or something is wrong with you, please go to the hospital. They will give you a dialysis there too and treat whatever the illness that is bothering you so that you'll be safe. After they stabilize you and make sure that everything is okay, then you can come. That's number one. Number two, when you come, please be nice. Be nice. Kindness. Oh my God. Smile. Be nice to the people that are going to take care of you. Being rude or calling them names, why you not putting me this and F that, it does not make sense at all. These are the people that you're going to stay with. These are the people that is going to take care of you. No need of calling them names for absolutely no reason at all. Some of them get so angry like you are the one that made them sick. We are there to save lives. We are there to help. We are not there to make your life miserable. Help us to help you. Help us to treat you right. Help us to give you a good treatment. Because when you are there cursing, you remember that you are cursing human beings like you. The way you are angry, how would you feel as you are cursing them? They are cursing you back. You are calling them BITCH and they are calling you BITCH too. You are calling them, all you people that came from Africa and you come here and take our job. You see, in dialysis, they have a lot of jobs there. They have a lot of jobs there that you can do. You don't have to discriminate at all because they are looking for people today and tomorrow. But the thing is, would you be able to do the work? Every work is not for everybody. So please be nice. When you are nice, the treatment is going to go very, very vara without any problem. Thank you. Number three, if you are scheduled to be there 3 times, you can see that I'm not looking at anything because this is a job that I do. I have everything in my head. If you are scheduled to be in dialysis 3 times a week, please be there. Please be there because that's the reason why your doctor gave you 3 times to come for dialysis. That's a reason for it. So you can get good clearance. I don't know. There's nothing else I can put in this one. Be there 3 times a week until your doctor makes another decision, either to reduce it or increase it. It is your doctor's. We only follow doctor's order. Doctor gives the nurse's order, and then the nurses, we work under their license. We follow what they want us to do. We follow the description of what the doctors want us to do. Please be there the time that you are expected to be there. Number 4, please finish your time. If your time is 3 hours, do 3 hours. If your time is 3.5 hours, do 3.5 hours. If your time is 4 hours, that's 2 people that have 410 in our clinic. And those 2 people, they come 2 times in a week. They do 4 hours, 10 minutes. I know it's not easy. I beg. Why would I say it's easy? It's not easy at all to stay in a machine, one place for 4 hours, for 3.5 hours, for 3 hours. But if that's what your doctor recommended for you to get good treatment, good clearance, please stay there and finish it. Please. The only reason you will go is maybe something is going on or whatever is going on once in a while. But don't make it a norm that you are here today. You said, oh, I just want to do 2 hours. You're not doing yourself good. You're not doing yourself good. And some technicians will just take you out after 2 hours because you said so. They give you paper, you sign your life away. You sign it by saying, yes, I told her what you're signing. In case you don't know, I am the one that give her permission to take me off. And one of the disadvantages of that is if your name is in a donor list to get kidney, they look at all these things, the history of how you're coming for your dialysis, the history of if you're following everything that you were asked to do. Because you know why? Because I have a lot of people that have gotten the kidney and their life did not change. They continue doing whatever it is that they were doing that made their kidney fail the first time. I know somebody that got it 2 times. 2 times. And all of them fell. Why? Because he was not able to change his lifestyle. Because when you get that kidney, you have a lot that you have to do. That's a medication that you will take for the rest of your life, because this is an object from another person's organ, from another person's body that is put in you when you get a kidney, and you have to do the right thing for that kidney to start getting used to your body again. So my people, please, When the doctor say don't drink because of your kidney, don't smoke because of the kidney that you got, don't eat so things, please don't eat it. What number am I? I don't know what number. So this one is to finish your treatment, right? Okay, let's go to the next one. The next one is when you finish your treatment, please don't get up too fast. Don't get up too fast. Just slowly get up. Don't bend down to pick up something from the floor. Your tech is there to help you. Say, please, can you be nice? Please, can you pick up that for me? They will get it nicely and give it to you without any problem, especially those nice ones. You don't even have to ask. We just pick it up, even clean it up for you with alcohol or bleach, and just hand you over to it without problem. But those ones that are wicked, you go figure. If you don't ask well, I don't know what to tell you, but so be nice. So don't get up so fast, because sometimes when you get up so fast, your blood pressure can drop so quick. Or you get up and bend down, you can drop. You know, a lot of things can happen in dialysis. We just have to be mindful of what we are doing. Another one is control your blood pressure. See, blood pressure is the leading cause of kidney damage. When your blood pressure is high, make sure it's under control. Make sure you are checking your blood pressure every time, and don't take blood pressure medication if your blood pressure is already low. No, don't do it, especially on your dialysis day. The doctors will, because some people will come to dialysis, their blood pressure will keep dropping because they are taking their blood pressure medicine while the blood pressure is already low. As soon as you put them there, if they have fluid that we are supposed to pull out, we cannot pull it because the blood pressure is low. The more you pull the fluid, the more the blood pressure drops, and the person can get sick and end up giving you more fluid to bring you back. So I won't say don't take it. It's just monitor your blood pressure before you take your pills. I won't say don't take it, because I'm not a doctor. Because there's some people that have blood pressure problem. Their doctor will tell them take it before you go to dialysis, because those ones are hard-headed ones that refuses to go down. Your doctor will tell you take it before you go, and a lot of people do. But a lot of them that their own drops so fast, they tell them don't take it. After dialysis, you check your blood pressure, then you take it. So they will never tell you not to. So keep that blood pressure under control. The next one is your sugar. Keep your sugar. Sugar too is the leading cause of kidney. Just imagine what kidney does. Kidney does a lot of work in your body, and when it fails, a lot of things suffering in your body. So that's why all these things, you have to make sure that you start checking them on time, so that you know where you have a problem, so that the doctors can start controlling it. So your sugar must be under control. The next one is, there's some diets that dialysis patients don't take. There's some diets, they constantly give them diets book to something. Say don't drink this, don't drink that, don't take any dark soda. You can drink ginger ale. I'm not saying you should drink ginger ale, but some of the things that they tell them, like the dietitian will come and say, don't drink anything diet, don't take stuff for phosphorus, don't take this for this. Excuse me. So be very, very careful. The things that they tell you not to eat. I know it's hard. I know it's very, very hard. Like me that like to eat my rice and stew. You tell me not to eat rice and stew. Wait till you want to make I eat. Something like that. You can once in a while eat your rice and stew. I'm just giving an example. You can once in a while eat your rice and stew, but be very, very careful how often you're eating it. Be very, very careful how you are managing your sugar, and how you are managing what they told you not to do. If they say don't eat this, please be very careful in eating those things that they say do not eat, because that's the reason why. And they always explain to you guys the reason why they say don't eat it is probably some chips. They tell you some of those ones that you cannot eat. Listen to them. There's a reason why they are there. So some dialysis patients will ask you, why are they always constantly drawing our blood? That's one of the things that is in my list, in my head. They draw your blood to run the test. Remember, I told you guys there's a lot of things that kidney will do. But now that the kidney is not working anymore, the only way they will find out where and where, what and what that you need help from is from checking through your blood. They draw the blood, they check it, they run it and see if a vitamin D or vitamin E or vitamin whatever, vitamin K or vitamin whatever is low. They know if your whatever if potassium is high, what kind of bath to use to bring it down. If it's down, which kind of bath to use to. They are constantly changing. When you're in dialysis, they're constantly changing the bath that we use to do dialysis, because sometimes your potassium or is high. They want us to use the low one to bring it down. Always low. They want us to use the higher one to bring it at a normal range. So there's a reason for taking those. So please, when they come, because some people don't allow you to take their blood anyhow. They think, I don't know if they think that we're just taking the blood to put in our own. No, that's not what we are doing. No, I beg. We are just drawing according to doctor's order and then sending them to the lab, and then they will tell us what and what and what and what that is wrong with you. If we need any change, that's the only way to know. So don't tell them not to draw your blood. Don't. Okay, guys. Don't tell them not to draw your blood. So, man, I wish I wrote the list down. But the few that I have told you from my head, the few that I have told you from my head, if you do it, and everything is going to be okay. Don't argue when you come. Sometimes you come, oh, everything is okay, you are looking good and you are fine, everything is okay. So in the middle of the treatment, something happens. The nurse noticed that something is going on with you, and the nurse said, you need to go to the hospital. It happened to one of my patients. You need to go to the hospital. She didn't want to go to the hospital, and the nurse insisted that you will go to the hospital, and she insisted that she's not going. So finally, the nurse called the doctor. The nurse called her doctor and said, hey, this and this and this is what is happening. And what do you want me to do? I've told her to go to the hospital and she didn't want to go. And she says she's having shortness of breath and this and that and that. And she's under her weight. She's under the weight that you prescribed for her to be in. And she says she's having shortness of breath. I would like for her to go to the hospital, because the nurses really runs the clinic. The nurses, when they make the decision and said this, that goes, because the doctor is not there. Doctor comes once in a while. So if they say go to the hospital, I beg, go. Everything is okay. You came in there and they said, no, something is wrong. You need to go to the hospital. You didn't know from home. Please go. And the person that I'm trying to tell you finally went to the hospital, only to get there. They say she has fluid in her lungs. She ended up being in the hospital for a very, very long, more than 3 weeks. After 3 weeks, she ended up in a rehab. And when she comes to the clinic, she said, Jane, I want you to challenge. Doctor said to challenge me. I said, no. Doctor cannot tell me to challenge you. Challenge and bring your target weight down. It is the doctor's responsibility to bring your target weight down. Then I start bringing the down according to the weight that she put. She cannot tell me to challenge. Challenge what? I can't. Because if anything happens to you, it will be me that they will hold responsible, because they can't come and tell you on the phone or tell you verbally without writing it down. No. It does not work that way. And that thing I was scared of. I was very, very scared that this woman is losing weight. There's no way she will not have fluid. She eats, she drinks. Please, reduce her target weight so we can put the fluid out. He didn't listen to me. I guess because my own license is too small. Only for her to get to the hospital after the nurse said that she should go to the hospital. She got fluid in her lungs and she ended up being out for over 3 months, So please, if The nurse suggests for you to go to the hospital because of what he or she has seen in you. Please go. Do not hesitate. Do not say, my doctor didn't say. She didn't want to go until her doctor called and said, listen to the nurse, go to the hospital. She went. At last, then she called and said, Jane, I thank you guys so much for insisting that I go to the hospital. We know now. We know what we're doing. Yes, we are technicians. It does not mean that we don't know what we are doing. We went to school for these things now. We took our board. We know one plus one, what it is. We didn't just, it's this, being a dialysis person, it's not a job where you just walk in. It used to be, you go walk in a day, but now you have to study for it, take your exam, pass it. If you don't pass it, you will not be there. So please listen to us when we tell you that so is going on. So is going on. And if you are that's another one. If you are one of those people that don't like to come to the clinic, they have home one too. They have home dialysis. It's your doctor that makes that decision. Even that one is cheaper for them. They don't have to pay us, the middle people. They don't have to pay us. They just train you and you stay in your home and do the dialysis. They monitor you. Some people are doing well with it, so you can do that too. It's not only being in the clinic. No, it's not only being in the clinic. There are many ways. And another one here is dialysis is not a handicap. It's not handicap. It's not when you are in dialysis, you said you are handicapped. You stop working. You stop doing it. When you stop working, I don't know, man. I do not know. But don't stop working when you are stabilized, because before it used to be so hard for them to know that somebody's kidney is damaging. But now it's becoming easy with blood work. They just do it and see what that is low or what that is high, that will tell them that it's affecting the kidney. And sometimes when you get inside that kidney dialysis, if they advise you to go, and you go, sometimes when you start the dialysis, I know a lot of people too that started the dialysis after a long talk. They started within 2-3 months, the kidney kicked back and they are dismissed to go, and they are doing fine today. So being in dialysis is not a death sentence. It's not a handicap, something. So be very careful what you do. Listen to your doctors, listen to your texts, listen to yourself, because yourself is more important, that you know when your body changes, so that you will know what to do. So my brothers and my sisters in Christ, this is just few things that I know as working in dialysis, few things that you can do to make you live long. I know somebody that has been in dialysis for 20-something years. I know one that said he's been in dialysis for almost 40 years. He said, I don't need kidney, because when you get kidney, too many problems, too many medication that you have to take. All I need to do with this one is do what they ask me to do, come here, get my dialysis 3 times a week, finish my time, and I'm done. And I am doing well. I'm not missing nothing. I do everything. And if you want to travel, you let the clinic where you are know that I will be going to California. It shouldn't stop you from living your life. I will be going to California in the next 1 month. I will stay for 1 week. Is there a way that they can make arrangements so I can go to dialysis close to me? Yeah, that's it. Social media, social worker will pick up her phone and start making calls to find out where you are going, and the clinic closer to you where you are going, and make all those arrangements. They want you to take your TB test or this and that and that. You get all those things done. When you get to your California to go and have fun with your family, when it's time for you to go to dialysis, you go to dialysis. You come back, you continue your fun. I know somebody that just went on a cruise. The cruise there have dialysis. He said they come to the bed and they give him dialysis. So dialysis is not a handicap. It's not a death sentence. Your life can still go on with dialysis. So please do the right thing by you. Do the right thing by you. Listen to all the instruction that is given to you. I know it's too much instruction. Tech is giving her own. Nurse is giving her own. Doctor is giving out. Listen to your doctors. If you don't listen to your tech, you listen to the nurse and the doctor. Listen to them. and it shall be well with you. So my people, share this video and send it to somebody that might need some of these tips that I put here, so that people are confused. When you are new dialysis, oh god, I'm making this video too long. When you are new dialysis patient, the denial in it is much. They can't believe that their kidney is damaged. They get sick out of fear. But after being there for like maybe a month or two, they start getting used to it. And then they're not scared anymore. They start realizing, oh, this is really not as bad. I know people that come inside with a wheelchair because of they have waited for a very, very long time. By the time they leave, they are fine. They are fine, and they will testify it themselves. They will tell you, I wish I started longer time. Oh, I've been telling myself that I don't need this, I don't need that. I really need it. So my people, let us help one another by sharing this video. Share this video so that people will know that dialysis is not a death sentence. It's not a death sentence. You can live with it and live a very good life. It's just a change. A change, like you want to lose weight, they tell you, don't eat this, do exercise, it's the same thing. The only thing is it has to be with your blood. That's all. And the trained people are taking care of you. You just relax, let them do their work, and you walk out very free and fine without any problem. So my lovely people, thank you so much for listening to all this long video. Oh my god, from me to you, thank you so much for watching. Bye bye.